welcome back to my channel. You know what we do here. We talk about motherhood, we share health tips, and we do vlogs on lifestyle. If you're seeing my channel for the first time, you're welcome to my channel. If you watched the video and you came to watch another one, you're welcome back. Mm. Remember to subscribe and to hit the notification bell to get notifications anytime I post videos, anytime I share health tips. Very important. Anytime I share health tips. Um, Today we are talking about myths in pregnancy and in breastfeeding. Myths in pregnancy and in breastfeeding, and what you should really know about this myth. Is it true? Should you do it, or you should ignore it? Okay, so let's get right into this video. The first thing they say is that pregnant women are not supposed to go out in the evening. If you go out in the evening, evil spirits, that is if you're from Africa, Nigeria to be precise. What they say is that pregnant women are not supposed to go out in the evening or in the night. Why? Because if they do, the evil spirits that move around, evil spirits that come out in the night, are going to sense that you are pregnant and possess your child. Hmm. So if you give birth to a baby that has one eye or has eyes that are not opening very well, or it's like if you have that kind of child, um probably an evil spirit changed the baby while you are in the womb. Here is what you should know. You see those drugs that you go to the chemist and buy on your own without a doctor's prescription. You see the alcohol you take. You see meals that you're not supposed to eat during pregnancy that you eat. They have told you, okay, don't take this medicine if you're pregnant. Don't drink Zobo. Don't do this if you're pregnant. And then you still go and buy it and you take it. That's what is making your baby have funny eyes. It's not an evil spirit. What you do is that if you have a baby that is just growing in the womb and you go about taking things that you're not meant to take during pregnancy, that is going to affect them, and then they will come out with a congenital disorder. Mm? So that myth, if you believe in evil spirit, okay, but I want you to know that that is a congenital disorder. It's not because an evil spirit changed your baby in the womb or anything like that. So this next myth is very funny. If they see you taking cold water and you're still breastfeeding, they'll say, mm, if you are still breastfeeding, I don't even know their reason for saying that, but they say it's going to affect your baby. If you're breastfeeding, you shouldn't take cold water. It's going to affect your baby. I don't know why they say that though. Here is what I want you to know as a breastfeeding mother. Mm? Cold water doesn't affect your breast milk. At least there is nothing to prove that it affects breast milk, right? Moreover, when you take cold water, it goes to your stomach first. Mm? So whatever is in the water is going to your stomach first. When you take water, it doesn't go to your breast now, it goes to your stomach first. The next thing is most newborns, if not all, they come out with a soft fontanelle. Fontanelle. What's a fontanelle? That soft place on a baby's head, that soft part of a baby's head, that is a fontanelle. So I can remember, let me tell you guys a story now. Growing up, I'll see that they will, okay, let me save that one for later. Let me tell you this one first. Um I took my baby for vaccination, And at the hospital, I had to take the clothes off for them to check baby's weight. And the woman looked at baby and she said, baby has okpa. That's soft fontanelle in her language. Okpa. Baby has okpa. So I was like, what's okpa? When she was done checking the weight, I just took my child and went back to my seat. And I was saying it down, and this woman said, my baby has okpa. Which one is okpa? So she was like, should she check? Is that thing here, that soft place? I said, oh, fontanelle. Okay. And then they will go and bring herbs that they'll give to your baby to drink. They'll give a baby to drink, and then they'll tell you to bathe your baby with these herbs, of which your child may not even be strong enough to receive such things on their skin, not to talk of drinking it. A baby, what some of them tell you is that you should wait until the baby is 3 months before you can start giving them the herbs. Let me tell you what is going to happen at that 3 months. When you get to that 3 months, by that time, the fontanel should already start closing. You see that soft place? You are going to have it two places on your baby's head, in front and at the back. The one at the back closes earlier. Around 2 to 4 months, it should close up. Whereas the one in front, it takes a longer time to close. It may be from 4 to 6 months thereabout. So your baby is going to be with that for some time, and but you just wake up and discover that it's not there. My baby was born with a soft fontanelle, and that's a very good indication for infection or dehydration. Why do I say that? If you notice that that soft part on your baby's head is sunken, has gone down, it means that your baby is dehydrated. It doesn't have enough fluid in his or her body. So you have to, breastfeed enough so that they have enough fluid in their body. If it's bulging out, if it is swollen, it means that is a sign of infection. So you can take them to the hospital to check what kind of infection they have and to treat appropriately. Don't go and carry herbs and be giving your 3 month old to drink and to bathe with because they have a soft fontanelle. That is soft there because the baby's brain is still growing and it needs room to grow. So that space, it helps you push out your baby easily. It helps you push out your baby easily, and it is going to help the baby's brain size. Help with the baby's brain size, help your baby's brain to grow as it should. If it closes before time, if it closes too early, your baby is going to have a funny head shape. So don't if it doesn't go, let's say at 1 year, that's 18 months, 1 year plus, then you can take them to the hospital to check why it's not closing up. But before that time, it's nothing to worry about. Just leave it. Just make sure the place isn't completely dry. Apply baby oil on their head. Apply whatever oil you're using just to ensure that the place is not so dry, and you can touch it. You're allowed to touch it, but don't press it. Then blue tongue. This is the one that is funny. Before I became a nurse, as a child, I would see that women would give birth in my village, in my neighborhood, and they say their tongue is white. So they will go and cut something. I don't even know the name of that thing right now. They'll go and cut one fruit. It has white milk and be dropping on the baby's tongue. If the tongue is bluish or it is thick, they will say baby has one thing like that. Clean your baby's tongue. Hmm? Clean your baby's tongue. You can use a face wash cloth. Put it in water that is mixed with salt to clean baby's tongue. Some people use cotton bud. Just make sure your hands are clean when you go in there and clean your baby's tongue. These days we even have toothbrushes for newborns, for infants. It has soft bristles. Mm? You can put it on your index finger. That's how the toothbrush is made. You can put it on your index finger and clean your baby's tongue. Don't allow it. If they suck for long and you don't clean it out, the tongue is going to appear whitish, okay, or bluish. You see this one? I'm personally a victim. So I dropped breast milk in my baby's eye and I noticed it was kind of getting clear. But when I saw an eye doctor and asked her about it, she said, there is no connection. Mm? It was just, your baby's eyes will clear out with time. The white of the eyes will clear out with time. It's not really about dropping breast milk in the eye. He got to that stage of his life where the eyes were meant to clear out. And then drooling in babies, salivating in babies. Why did you eat what was this thing? When they say your baby drooling, they say, you ate too much of okra. You ate too much of iwedu. At TV. Your baby might be drooling more than usual because he or she is teething and not because of what you ate. That is what I want you to understand. When they come and start, I'm telling you now, I'm teaching you now. When your baby comes and sorry, when someone, all these African women, when they come and they start telling you that your baby is drooling so much, um what did you eat? Did you eat too much of okra? Tell them it is because baby is teething. He's meant to drool at that point. That is because of the discomfort he's feeling, and sucking on his fingers, sucking on things, and trying to rub his tongue on his gums. That is what is making him drool. It is not because of what you ate. Then they will say, "Hey, if you cross a dog, if okay, not yes, cross a dog. If a dog dies and you bury it on the ground and you cross that place, your baby will die. And any pregnancy, anytime you take in, the baby will die. Or if you eventually carry it to term and you give birth, the baby will die." Now, wow, because you cross ground that they buried, that is not true. I'm telling you today that you may have fetal death. Your baby, when it's still in the tummy, it's called a fetus. So when you have fetal death, that is because of other things, not because you crossed a dog. Other things like what? Maybe you took something that you're not supposed to take and it has affected that baby. You had a disease condition you refused to treat and it affected that baby. You are not eating well, the baby wasn't getting enough nutrients. The fetus died, not because of crossing, and so many other things that make cause fetal death. Then this one, they say a pregnant woman is not supposed to break firewood. Actually, this one, yes, I will agree to that. Why? Not because of those other many things too. Because if a pregnant woman engages in such activities such as breaking firewood, that is going to cause the placenta to separate from the child or to separate from you before time, and that will lead to fetal death. Not because you cross a dog or because you and that will cause fetal death because baby gets nutrients from your placenta, and if detaches before time, it's going to cause a lot of distress. Then some certain people refuse to get immunization. Is that one really hmm, is that one really a myth? If you refuse to take your child for immunization, you don't know what you are doing to that baby. You see all this polio people we have up and down. You see them, somebody with small hand, small leg, all those things. Those are as a result of lack of vaccines to prevent the disease conditions that cause those things, cause them to have those small hands and small leg. Polio, for instance, can make someone have that kind of small leg and small hand. It's very important for you to take your child for immunization. If you have, for example, am I allowed to mention? I will just call this particular tribe immunization. And that's why you see most of them, you see them on the streets, and some of them can't walk, they're in wheelchairs, and some of them are crawling on the ground. That is because of lack of immunization, and they got a disease condition and made them leprosy. They say pregnant women are not supposed to go to the river in the night. Okay, it's very funny. But you said, what are you going to do in the river in the night? What are you going to look for in the river in the night? So I don't really know what to say. It's not safe. What I can say is that it's not safe for you based on terms of you exposing yourself to danger, not because someone may change your baby in the tummy from male to female, or make them come out with funny looking eyes. Like I said, that is as a result of congenital disorder, not because an evil spirit changed your baby. Don't go to What are you going to do? If you need someone to fetch water for you, tell them to get water for you from the river. You don't have to go to the river in the night. What are you going to do there in the night? And most importantly, last not the least, and most important, jedi jedi. Mm. They will bring herbs for you to take. Beat your baby with this and give your baby this. If you have jedi jedi, let me say it in the simplest way that I can say it for you. If you're an African mom and you keep beating your baby with herbs and giving them things that are stronger than their sister in the name of jedi jedi, that's simply a sign of infection. Sign of infection. And they can have this redness around their genitals, their private parts, those rashes, and some of them you see them, they are stooling, they are vomiting, they have fever, those restlessness. That is because your baby is infected, and you need to take them to the hospital to check what they are infected with and to treat very well. Stop giving even for adults, these herbs, some of them are too strong for your liver, too strong for your kidney. You carry herbs and give a baby that is some of the organs are still developing, or are not really strong enough. Why are you doing that now? Why are you doing that? Hmm? So that this thing that they will pack this time begin, that's just a myth. Jedi jedi is infection. Don't go and be giving those herbs. They say you have to bathe with you must bathe with those things before it will go. It is a mythology. It is not. It's a wrong notion. It's a wrong thing to say. Do not carry herbs and be giving your 2 months old, your 1 month old, your 3 months old. Take them to the hospital to check what they are infected with and to treat very well. I had a good time filming this video. I had a good time making this video, and I hope you guys enjoyed watching it. If you did, please remember to like it and comment, and most importantly, subscribe to my channel to get free health tips such as this one you just got in this video. Remember, you don't have to run to the hospital every time. Ask Nurse Kids. Bye.